Welcome, everybody. Today we will be talking about one of the most popular diets as of now. Have you ever wondered what the keto diet is or wanted to try keto? Well, here are some things you should know before joining the latest fad. So we'll be going over what is it, learning about carbohydrates, ketosis and what that is, why it's popular, its effectiveness, concerns and complications, healthy fats versus bad fats, diabetes, and heart disease. So what is the ketogenic diet? The ketogenic diet was first used as a treatment for epilepsy by Dr. Russell Wilder in 1921. It was the main treatment up until anti-epileptic medications became available. Now it's one of the most popular diets for weight loss. You can't go to the grocery store without spotting something labeled as keto or keto friendly. So it is a diet that is high in fats, being made up of 55 to 60% calories from fat, moderate protein of 30 to 35% of calories, and only 5 to 10% of calories coming from carbohydrates. Based on a 2,000 calorie diet, that is only 25 to 50 grams of carbohydrates a day. That means it is possible to have some fruits and grains. And to put that in perspective, 25 to 50 grams of carbohydrates equals about 1.5 large apples or 3 small apples or 1 to 3 slices of bread. Carbohydrates. Carbohydrates get a bad rap, but they are broken down to produce our body's preferred fuel source, glucose. Our brain loves glucose. It thrives with glucose. It provides mostly all of the daily energy the brain needs in a day. Glucose is also important for exercise. It's stored in our muscles as glycogen to keep them moving and prevent fatigue during a workout. They're found in grains, fruits, vegetables, dairy, and even alcohol. Fiber is a type of carbohydrate that the body can't digest. It has a lot of great benefits that we will be talking about in a little bit. Then our bodies have the ability to turn protein into glucose to use for energy, and that is called gluconeogenesis, which simply means new glucose. But what happens when we use fat as an energy source? Ketosis occurs. After we limit carbohydrates, our body switches to defense mode and starts using our glycogen stores to provide the body with more glucose. This is what we referred to earlier as gluconeogenesis. After our body uses up its glycogen stores, it starts using other sources like protein to produce glucose. Then from our liver cells, ketones are created from fatty acids to use as an alternative fuel source. The body starts creating and using ketones as energy, which is the state of ketosis. So why is this diet popular? Well, it's extremely popular due to the claim that it helps people lose weight quickly, lessen brain fog, which is your ability to think clearly, feel great, and manage diabetes. According to the U.S. Health News, despite its popularity, it is ranked as number 37 out of 39 of overall best diets, with a score of 1.9 out of 5. A panel of 9 experts, which are shown on the right, score the diet based on 4 criteria: short-term weight loss, long-term weight loss, easy to follow, and healthy. To read the full article, the link is below the scorecard. Does it work? Yes and no. At the beginning, when you experience the instant weight loss, although encouraging and exciting, it is mostly water. The ketogenic diet can produce a diuretic effect, which is losing water or fluid from the body, and it means more trips to the bathroom. With this diet, there is a risk of possible weight gain too. The ketogenic diet is high in fat. Fats are higher in calories than carbohydrates and protein at 9 calories per gram, and it is easier to gain weight if consumed in excess. However, the ketogenic diet is effective for treatment for kids with epilepsy. Children on this diet reduce their seizures by 50%, and a small percentage become seizure-free. For these children, being thrown out of ketosis can start seizures again. Concerns and complications. Have you ever heard of the term keto flu? It's a term people use to describe a set of symptoms at the beginning of ketosis that include but not limited to poor concentration, nausea, vomiting, weakness, constipation, diarrhea, headache, stomach pain, muscle soreness, and dizziness. So after a week, when your brain gets used to using ketones, these symptoms may or may not go away. It really depends on the person. You should also know that emergency visits often occur when on the diet because it can cause hypoglycemia, which results from eating a very low carbohydrate diet and no sources to produce more glucose. It can also cause dehydration and deficiency in electrolytes. The short-term effects are more researched than the long-term effects of ketosis. But one of the reasons medical providers don't always recommend the ketogenic diet is because we don't have the research that shows what happens in the long run when your brain is completely fueled by ketones. Another reason why medical providers don't recommend the keto diet is related to the fact that it is a very restrictive diet. Stress can result from being on a strict diet, not being able to dine socially, or having to constantly look at how many carbs each food item has. It also doesn't teach good eating behavior. Once off the ketogenic diet, weight regain is possible if it is not known how to manage nutrition after the diet. Nutrient deficiencies are possible with the ketogenic diet as well. For example, vitamin C is in a lot of plant-based carbohydrates, not to mention when you limit fruits, you are reducing antioxidants and phytochemicals, which are plant chemicals that are beneficial. The process of making ketones from fatty acids is a lot slower than gluconeogenesis, which is the making of new glucose. When working out, your body uses the glucose stored in your muscles, which is glycogen, to keep up the endurance and to prevent early muscle fatigue. But since glycogen stores are used up, the muscles aren't supplied with immediate energy that they need to continue. And that also makes it so you have muscle soreness and a slower recovery time. Fiber. Fiber is very beneficial. It helps us feel full, lowers our blood cholesterol, treats and prevents constipation. And last month was Colorectal Cancer Awareness Month, and it's important to note that fiber reduces the risk of colon cancer. And lastly, it helps us control blood sugars. Fiber is found in fruit, vegetables, legumes like beans, and whole grains. However, those food groups that are heavily restricted, those because they contain carbohydrates. So we lose that when we cut that group out. So who shouldn't do the ketogenic diet? People who shouldn't try to do the ketogenic diet are those who have problems metabolizing fats and other nutrients. The pancreas and liver are involved in fat metabolism, and the ketogenic diet is high in fats. And excessive protein can overwhelm our kidneys, so it is not recommended to do the ketogenic diet because not only is it high in fat, but it may also be higher in protein compared to the normal diet. And more research needs to be done on thyroid conditions and the ketogenic diet, but some research suggests that eating a low-carb diet may lower the thyroid hormone levels, which may not be good for someone who has hypothyroidism. And like the thyroid, more research needs to be done in regards to the ketogenic diet with a removed gallbladder or gallbladder issues. So the ketogenic in diabetes. Remember how ketones are formed when there is no glucose supply? When on a diet or fasting, insulin levels become low, but glucagon, which is the opposite of insulin and increases blood sugar, mixed with adrenaline, the hormone that helps pump blood and release blood glucose, are at normal. Under these conditions of low insulin with normal glucagon and adrenaline, fat is released from the fat cells, and then it heads over to the liver where ketones are then created. It is very important to make sure you adjust your insulin or diabetes medication with your doctor when you start keto because the job of insulin is lower blood sugar. And if blood sugar is decreased already, hypoglycemia or low blood sugar will result. Diabetic ketoacidosis is a condition in which the body keeps producing ketones to the point where there is too much in the blood. Usually this is due to too much glucose and not enough insulin, often seen in diabetic people with uncontrolled blood sugars, especially in type 1 diabetics. This is different than the ketogenic diet where the blood sugar is low, but they end up with the same result of creating ketones. So just err on the side of caution, again, due to the lack of research, and watch out for signs of ketoacidosis like fruity scented breath, excessive thirst, frequent urination, nausea and vomiting, confusion, stomach pain, and weakness. Check your blood sugar regularly and check your ketone levels to make sure they're not high. In the short term, blood sugar levels are improved, but there's not enough research to say if it manages blood sugar long term. For people with insulin resistance or people who don't make as much insulin, this diet has been recommended not for weight loss, but to ensure there is enough fat for fuel because there's not enough insulin to process glucose. And look at that picture of bacon. The ketogenic diet is a high-fat diet. It has been nicknamed the bacon diet, but fat plays an important role in heart health. Too much saturated fat, which is also in bacon, may raise your LDL or your bad cholesterol and put you at risk for heart disease. It's recommended that no more than 10% of your daily calories should come from saturated fat. And besides fat, sodium is also a consideration when we talk about heart health, since there are a negligible amount of carbs and meat. It's easy to include meats in the ketogenic diet. Processed meats are high in sodium, so it's preferable to choose fresh, cooked meat. I would also like to mention fried foods. Some foods are fried without breading, but will include more fat and sodium in them, so try baked food instead of fried foods. So healthy fats and bad fats, what are they? It's important to tell the difference between the two. Healthy fats are considered unsaturated fats. They raise good cholesterol and lowers the bad. They include foods like olive oil, avocados, nuts, and seeds. Unhealthy fats are saturated in trans fats. They include butter, bacon, fatty meats, lard, coconut, yes, coconut, shortening, and stick margarine. If you're not sure whether or not an oil is saturated or unsaturated, Unsaturated fats are liquid at room temperature and saturated fats are solid. And if you have a problem telling the difference between HDL and LDL, HDL is the good, which H, heavenly, and the LD and LDL, little devil, just to remember the difference between the two. So instead of a ketogenic diet, a better option for losing weight and being healthy is to consume a balanced diet. There is no need to omit foods or count calories. Plant-based foods, which often contain carbs, include fiber, antioxidants, and necessary vitamins and minerals. Lean meats and seafood are recommended, but there are other plant-based protein options like garbanzo beans, tofu, peas, edamame, and more. The Mediterranean and DASH diets are both balanced diets. The U.S. News article mentioned previously that ranked the keto at number 37 ranks these two diets as number 1 and 2 on the best diet list. So in summary, take caution before trying the ketogenic diet. Weigh the pros and cons. Consider a balanced diet instead, and please talk to your doctor first before trying the ketogenic diet. Thank you for watching this presentation. Like and share this video for people thinking about trying out the ketogenic diet. Comment if you have any questions. For more tips on health and wellness, like the Ignis Indian Health Center's Facebook page and follow us. Warm weather is almost here and it's time to start gardening. For fun cooking videos and tips on how to prepare fresh vegetables and fruit, check out our YouTube page and subscribe. Thank you.